Good afternoon, everyone. We're going to call this meeting of the Health and Human Services Subcommittee to order. Colleagues, today we have one readout from the Maryland Department of Health, Developmental Disability Administration. And at this time, we have Ms. Victoria Martinez that will be giving our analysis.
Thank you, Mr. Chair and members of the committee. My name is Victoria Martinez, and I'll be providing the budget analysis for the Developmental Disabilities Administration. DDA provides services to individuals with intellectual and developmental disabilities, primarily through state facilities and community-based services. As you can see on the first page of the analysis, the fiscal 2026 allowance decreases by $190 million, or 6.6%, for a total of $2.7 billion. Moving on to the discussion of the performance analysis, beginning on page 4. The first performance measure discusses DDA's goal of increasing enrollment in a home and community-based services waiver to allow DDA to claim federal funds for services. As shown in Exhibit 1 on page 5, in fiscal 2024, there were 20,000 individuals served in community services, of which 19,000 were enrolled in a waiver, representing a slight decrease from 2023. Exhibit 2 on the next page shows enrollment in each of the 3 DDA waivers, and Exhibit 3 on page 7 summarizes the services offered in each waiver. Redetermination for Medicaid waivers typically occur annually, but this was paused during COVID-19. When Maryland resumed the redetermination process in April 2023, there was an error in which some participants were inappropriately disenrolled. MDH reported having reinstated 304 participants that were inappropriately disenrolled. The second performance measure, beginning on page 8, discusses the community services waiting list placements. Exhibit 4 on page 9 shows that there were almost 4,000 individuals on the waiting list in fiscal 2024, which is an increase from 2023. The last performance measure, that begins at the end of page 9, discusses improvements in meeting person-centered plan goals. There are 3 goals related to timely review of person-centered plans that were established in fiscal 2022. Exhibit 5 on page 11 shows the improvement in meeting these goals from fiscal 2020 to 2024. Moving on to the discussion of fiscal 2024, beginning at the bottom of page 11. As required by the budget bill, DDA submitted a report on advanced payments given to assist providers in their transition to LTSS. DDA provided a total of $457 million in bridge payments, most of which have already been recouped. To recoup these payments, DDA created accounts receivables, and DDA covered about $346 million of spending in 2024 with these recoupments. DLS determined this report to be in compliance with the budget bill language and recommends that withheld funds be released, and will process a letter to this effect if no objections are raised during this hearing. Because information on accounts receivables was not provided at fiscal year closeout, DLS also recommends restricting funds until a closeout report and closeout budget amendments are submitted. Moving on to the discussion of fiscal 2025, on page 13, the fiscal shows that the fiscal 2026 allowance includes 9 deficiency appropriations that add a total of $740 million to the fiscal 2025 working appropriation. This includes an increase of $900 million for community services spending and a decrease of $160 million due to various cost containment actions. Exhibit 6 on page 14 shows an overview of agency spending in fiscal 2026. About 97% is for provider payments in the community services program, and the remaining 3% includes spending for the federal disallowance, utilization review services, regional offices, and other operating expenses. In 2018, DDA received a formal disallowance letter from CMS regarding unallowable Medicaid costs. DDA submitted an appeal that was denied in October 2024, so the fiscal 2026 allowance includes $39 million to pay for the disallowance and accrued interest. Exhibit 7 on page 15 shows community services spending, the majority of which, about 53%, is for residential services. Exhibit 8 on page 16 provides a breakdown of the $190 million decrease from the fiscal 2025 working appropriation. Most of this change is within the community services program and is mainly attributed to a year-over-year decrease of $297 million for cost containment actions. This decrease is partially offset by increases of $37 million for expansion of waiver services and $28 million for a 1% provider rate increase. The fiscal 2026 budget plan includes significant cost containment actions, including reductions of $160 million in 2025 and $457 million in 2026. Exhibit 9 on page 18 shows the reductions from the cost containment actions as budgeted. Since most of these actions that were introduced in 2025 are ongoing, they continue into 2026, and 2026 shows the annualized cost savings from these actions. The savings from 3 of these cost containment actions were incorrectly estimated, leading to a projected deficit of $88.6 million in fiscal 2025 and $5.5 million in 2026. Exhibit 10 on page 20 shows the correct cost containment reductions, with the text highlighted in green showing the difference from the original budgeted amount. DDA reported that the geographical differential elimination, the action to direct transitioning youth into the traditional model, and the self-directed services cap on IFDGS require CMS approval. Since a waiver amendment hasn't been submitted, the geographical differential elimination will not be able to go into effect in fiscal 2025. Other changes include correcting the budgeted effective dates and fund splits for some of the actions, and DLS has asked that DDA provide an update on submitting the waiver amendment to CMS for needed actions and to comment on plans to correct the deficit. Exhibit 11 on page 22 and 23 provides a summary of each of the cost containment actions. Some of these actions reduce services provided to participants, while others impact the rates that providers receive. 3 cost containment items are contingent on passage of the Budget Reconciliation and Financing Act, including the waiting list equity fund swap, the list program elimination, and the self-directed services cap on IFDGS. In terms of personnel, there are no significant changes. The vacancy rate remains high with 29 vacant positions, which are shown in Exhibit 14 on page 30. Moving on to the first issue, this discusses, which is beginning on page 31, this discusses DDA's community services spending and transition to LTSS. Exhibit 15 on page 31 shows actual community services spending compared to the appropriation, showing that spending surpassed the appropriation by significant amounts, including by $427 million in 2023, $724 million in 2024, and $749 million projected in fiscal 2025. Exhibit 16 on page 33 shows the general fund and federal fund split for community services spending. Although spending is typically paid for with a little bit over 50% general funds, DDA received additional COVID-19 related federal funding that covered the increased spending in 2021 to 2023. In 2024 and 2025, there were less federal funds, and so more general funds were needed to cover the growth. Exhibit 17 on page 34 shows the yearly growth in community services spending. The highest year-to-year growth was in 2024, with a growth of $590 million over the previous year. And Exhibit 18 on the next page shows what is driving that growth in 2024. Some of the key components of the increase were expected, such as two provider rate increases, but the factor driving growth, driving most of this growth is an increase in spending in the traditional model, which is mainly attributed to the LTSS transition. The LTSS transition was finalized in September 2024 and included moving providers from a prospective payment model to a fee-for-service reimbursement model in LTSS. Since most providers transitioned in 2023 and 2024, these years had the highest growth in spending. Throughout the LTSS transition, DDA was required to submit quarterly reports with spending forecasts of what fiscal 2024 would cost having providers billing in LTSS. Exhibit 19 on page 37 shows the first three spending forecasts that DDA submitted compared to actual spending for fiscal 2024. In the first forecast, DDA estimated that the cost would be about $1.8 billion, but actual spending was about $908 million more than this original forecast. DLS recommends adding language restricting $2 million pending quarterly reports with monthly spending data, and DLS also recommends not releasing funds if the reports are late. Most of the growth in costs throughout the LTSS transition is estimated to be due to the increased rates that were built into LTSS. Exhibit 20 on page 38 compares the total per person per month costs in both systems, showing that reimbursements provided for services were about 18% higher in LTSS. Considering the significant growth in spending beyond the budgeted levels, DDA did not accurately project the affordability of the new rates and the impact that it would have on the state budget before implementing the LTSS transition. So DDA should discuss how it will set rates within its budget going forward. In addition to the higher rates in LTSS, providers have received several rate increases in the past 10 years, as shown in Exhibit 21 on page 39. Due to the fiscal outlook, DLS recommends eliminating the provider rate increase of 1% in the fiscal 2026 allowance. DLS notes that the General Assembly may wish to reinvest these savings to restore specific cost containment actions proposed in the allowance. The second issue, which begins on page 40, is on spending growth under the self-directed services model. Individuals have the choice of participating in two service models, the traditional or the self-directed model. The main difference is that through the traditional model, a participant receives services through a provider, while in the self-directed model, a participant has employer and budget authority and can choose who provides their services. Although individuals in both models receive an approved budget based on their assessed need, participants in the self-directed model manage their own budgets and can spend any unallocated funds or savings from underutilization of services. Exhibit 22 on page 41 shows the growth in enrollment and total spending in self-directed services, and Exhibit 23 on page 42 shows the spending per participant by service model. This shows that spending has been increasing in both models, but enrollment and spending in the self-directed model has been growing at a faster rate in 2024. Exhibit 24 on page 43 shows the community services spending by service model. In fiscal 2026, the traditional model decreased by about 2%, while the self-directed model decreased by about 41%. In addition to the cost containment decreases in self-directed services, there is a $16.8 million decrease that DLS has asked DDA to explain. Moving on to the discussion that begins at the bottom of page 43, DDA recently published the Self-Directed Services Manual that went into effect in November 2024 that included several new documentation requirements. One of the changes is that to access goods and services through IFDGS, participants are now required to submit 3 months of personal bank documentation and a list of all planned monthly expenses, showing that they do not have other funding available. So DLS has asked that DDA comment on any privacy concerns from requesting participants' bank statements and any additional administrative burden. The last issue that's discussed on page 45 is on the adequacy of the fiscal 2025 and 2026 budgets. Considering the rapid growth in community services and actual spending consistently surpassing the legislative appropriation, it's unclear whether the 2025 and 2026 budgets are adequate. A rough estimate indicates a projected shortfall of about $150 million in general funds for fiscal 2025, and a shortfall is also very likely in fiscal 2026, considering the trends. MDH should comment on the adequacy of the fiscal 2025 and 2026 budgets, in addition to providing the anticipated deficits and plans to reconcile the shortfall. I'll end this presentation with DLS's recommendations that are listed beginning on page 46. I've already gone over recommendations 1, 3, and 5, so I'll discuss the ones that I haven't talked about. The second recommendation is regarding the fiscal compliance audit issued by the Office of Legislative Audits. The audit indicated that DDA had 4 or more repeat audit findings, and this language restricts funding pending corrective action by DDA. And the fourth recommendation is annual language that restricts appropriations provided for the community services program for that purpose only. With that, I'll end my presentation, and I'm happy to take any questions.
Thank you. Senator Zucker.
Thank you very much. Thank you for that great analysis. So should there be any changes in this current fiscal year 2025 in terms of changes to the cost containment? Would DLS withdraw their deletion recommendation for item 5?
Are you looking, which page are you looking at?
Page 48. It's recommendation 5.
Could you repeat the question?
Sure. So this action is based on filling cost containments for the fiscal year, right? Correct? It's making a fix. So if for some reason those cost containments were addressed in another way, would DLS remove the recommendation to delete the provider rate increase?
DLS would still recommend the provider rate increase. This is based on the overall fiscal outlook.
Thank you very much.
Seeing no further questions, colleagues, I'm going to ask for the agency if we can have Deputy Secretary Elena Hutchinson and her team.
Good afternoon, everyone. My name is Marlena Hutchinson. I'm the Deputy Secretary for the Developmental Disabilities Administration within the Maryland Department of Health. Today, I have with me DDA's Chief Operating Officer, Mr. Robert White, here to my right, and also DDA's Director of Finance, Mr. Nick Gabor. Thank you, Honorable Chair McCray and honorable members of the Senate Budget and Taxation Committee. The Developmental Disabilities Administration within the Maryland Department of Health is very appreciative for our partnership with you all as we continue to strengthen and stabilize the DDA service delivery system. Right now, we know that many in the disabilities community are feeling frustrated, disappointed, and anxious about what lies ahead. These are challenging times. Maryland is facing a $3 billion budget deficit, creating significant financial challenges. There is also uncertainty and much angst around future federal funding to states for human services programs and other matters. Acknowledging some of these dynamics, there are many contributing factors that lead to difficult budget decisions. But we know and we understand that the strength of our community is measured by how we uplift and empower one another to work together to address and solve big problems. The disabilities community has stepped up and made their voices heard. The Maryland Department of Health fully recognizes that the proposed reduction to the DD budget has real consequences for the people who rely on these services. Today, we are happy to report that the administration, in partnership with the General Assembly, has just announced that 94% of the funding for fiscal year 2025 will be restored for the Developmental Disability Administration services. As we move forward to the process of passing a balanced budget for fiscal year 2026, we have no higher priority than the people of Maryland as we navigate federal and fiscal uncertainty. We also want to recognize and express our sincere appreciation for Chair Gazzoni's leadership and partnership. We thank him for being a longtime advocate and champion for the intellectual and developmental disabilities community. Along with our partner agencies, the executive branch, and the legislature, we are actively working to engage with participants and families, providers, advocates, and stakeholders to listen, collaborate, and find sustainable solutions. Together, we are actively working to explore alternative approaches to protect essential programs while balancing fiscal realities. Together, we are actively working to seek federal funding opportunities that can supplement and stabilize key services. And together, we will consider budget reallocations and cost savings efficiencies to minimize disruptions to participants and families. Please be assured that we are here as a partner, and we will stay true to our commitment to continue working as hard as we can to find solutions to protect the vulnerable individuals who need these services and supports, while also having to manage budget modifications to our service delivery system that promote access and sustainability. We believe you want the same, and please know that we share these common goals. We are particularly grateful as well to you, Chair McCray, for your partnership and calling out to us the low-intensity support services program. Based on conversations with Senator McCray, the executive branch and our partner agencies and the advocates, the administration plans to amend the proposed budget Reconciliation and Financing Act to suspend rather than eliminate the LIST program. Now I would like to briefly summarize the department's written responses to DLS's questions and recommendations before opening the floor for questions from the committee. Question number 1, related to the status of submitting a waiver amendment to CMS to enable certain cost containment proposals, the department notes that a waiver amendment is necessary to implement the cost containment proposals related to the geographical differential rate, individual and family-directed goods and services. It is also important to note that the department no longer anticipates needing to pursue the action to limit transitioning youth to the traditional community provider services model, as we believe that the proposed changes to the model and the respective cost containment policies will result in this action being unnecessary. The department will continue to work with its executive branch, its partner agencies, the legislature, and the community to monitor and manage the implementation of the proposed cost containment strategies. Understanding that waiver applications require a 30-day public comment period and at minimum 90 days for the Centers for Medicare and Medicaid Services to review our application, we will continue to work with our partners and adjust our timelines accordingly. Regarding DLS's request that we comment on plans to correct the inaccurate estimating of the cost containment savings for fiscal year 2025, and that we replace the federal funding that was inadvertently reduced in the governor's allowance related to the low-intensity support services program, the department is working with its partner agency, the Department of Budget and Management, to update these items. Related to the Waitlist Equity Fund, the DDA currently estimates that approximately $15.9 million will be available in this fund by the conclusion of fiscal year 2025, which is June 30, 2025. Related to the requested report on fiscal year 2025 year-to-date community services spending, the department submitted this report to the legislature on February 18, 2025. We apologize for the delay in submitting the report and will work with our partner agency, the Department of Budget and Management, to improve the timeliness of our submissions going forward. Related to tracking the affordability of LTSS Maryland rates, the department notes that it will continue to utilize its established rate-setting process through the Rate Review Advisory Group and the Hilltop Institute. Related to a $16.8 million decrease with the Department of Legislative Services that they observed in our self-directed services model, the department respectfully requests follow-up with DLS for additional clarification. Related to the Self-Directed Services Comprehensive Policy and Manual in the fall of 2024, the department notes that these policies are not designed to or anticipated to generate cost savings. The updated manual and policy improve documentation requirements to enhance program integrity and compliance in accordance with state and federal requirements. Related to the requirement that participants not have other funds available to purchase optional goods and services through individual and family-directed goods and services, the department notes that this requirement is a part of its service requirements for this service. DDA uses a HIPAA compliance tool. And also, it's important to note that the participants previously attested to having this information and agreed to provide it upon request. Now that it's a documentation requirement, participants must provide the information upon submitting their requests for consideration. Related to anticipated additional shortfalls in fiscal year 2025 and 2026, the department notes that it is working closely with the Department of Budget and Management to update the administration's cost projections for both years to reflect changes since the governor's allowance was finalized. Like DLS, we currently estimate additional shortfalls in both years due to a combination of continued increased cost trends since fall 2024, as well as changes to our projected savings from cost containment actions in fiscal year 2025. The administration is working on a proposed fiscal year 2025 deficiency request and a supplemental budget for fiscal year 2026 to resolve the additional projected shortfalls. We understand that DBM anticipates sharing the administration's plan with the legislature in early March of 2025. Finally, for DLS's operating budget recommendations, number one, In regard to the 3 recommended reporting requirements, the department concurs, and this is around adding language to restrict funds pending the submission of a report on fiscal year 2025's closeout and closeout budget amendments, adding language restricting funds pending the resolution of repeat audit findings, and adding language restricting funds pending quarterly reports on community services, spending, enrollment, and utilization. Related to language restricting community services appropriations, the department respectfully disagrees. Related to the recommendation to remove the proposed 1% provider rate increase in fiscal year 2026, the department acknowledges DLS's recommendation to the legislature. Thank you very much for your time today. Also available for questions this afternoon are our Chief of Staff for the Maryland Department of Health, Aaron McMullen, as well as our Chief Financial Officer, Emily Bradenberg. Thank you so much.
And thank you, Senator Jennings.
Thank you, Chair. First of all, thank you very much. You and I had a meeting, was it yesterday or 2 days ago?
Yesterday.
These days run together. I commend you for, it was almost an hour we spoke, and I appreciate it. We kind of opened up dialogue and really, I think, worked through a lot, and I appreciate that. And I also commend what you just announced. So you said you've restored back 96%?
94%.
94. So it's, my math, I guess, what's 188 million?
We're at like 90, let's see.
And that's what I just did in my calculator, so.
It's a little over 100, I believe.
Oh, okay. So, all right. Well, that being said, the big thing I've gotten from, as we spoke yesterday, or from my constituents, the thing is dealing with their staff. You know, there's a big thing for a lot of parents and caregivers is making sure they have consistency with their staff. Long-term staff really helps. Are you going to continue with removing of the geo differential and reducing staff wages, or are we going to eliminate that and continue? I'm just curious now with keeping the budget the way it was.
So in regard to the department's plans to implement its cost containment strategies, we're going to continue working with our executive branch as well as the legislature and the partners to move in the direction that supports the proposed cost containment strategies around GeoDiff.
So you're going to continue with that?
Continue those conversations and,
Okay.
and moving in that path, yes.
All right. Okay.
Senator Zucker.
Thank you very much, Mr. Chair. It's good to see you all. Just wanted to see, and thank you for your efforts and your collaboration with those that would be impacted by the budget as introduced. I know that the administration has been working collaboratively with stakeholders, and I know that's how government should function and deliver. So I guess the question I had is, what's the where are we with End the Wait, and what's the future of End the Wait at this point?
So for me, because that is a part of the Medicaid budget, I am not prepared to speak on that. It's my understanding that Deputy Secretary Moran will be speaking to that at his budget hearing tomorrow.
Thank you very much. I'm sure the Secretary is now aware that I'm going to ask the question, so I appreciate it.
Senator Heddleman.
Thank you very much, Mr. Chairman, and thank you. And thank you for your willingness to talk with us and with me and spend some time in my office as well, so I appreciate that. I was actually kind of curious to hear you state that the manual, the purpose of the manual was not cost efficiencies, but it was rather to increase documentation. And I just have to share that the people that I have heard from do not feel that way. They feel that it is all about cost containment, and I think most people don't have a problem with documentation. And so I guess I'd love to hear your elaboration about that. And I mean, I think that they've experienced that services that they were getting, even when they're complying with the plans that have already been agreed to, were not, now they're getting denied for them. And so if that's not about, and they, at least the ones who've spoken to me, have told me that they are providing documentation that they have been providing historically, or that are totally in alignment with what their plans allow. So I'd just like to give you an opportunity to comment on that, if I could.
So sure, again, the participants' services are based on their assessed needs, my apologies. There was no goal, there is no goal, there was no calculation to generate cost savings based on the updated policy and manual. What the department did was pulled into one document a variety of policies that we had across our entire electronic platform, the website, and as a result of hearing from stakeholders requesting information and making certain that things were in one consolidated place, that's exactly what the policy manual did. And also because the department has program integrity and compliance requirements that it must meet, that's where the documentation standards came in. Participants have long time attested to the documentation and said that they would provide the documentation upon request. Now we're just asking for that documentation up front upon request.
So if I could have one follow-up, Mr. Chairman. So I'm just going to give you one example, and this was shared with me, that somebody who had been approved for, I guess, increased pay for holidays, and you know, it was required to be submitted, I don't remember the time, but X period of time before the holiday. The manual came out shortly before Thanksgiving, and then there was Christmas, so it was physically impossible to be able to submit the request with that amount of time, because this was a new policy and it was within that time period. So those, and here we are now in February, and those requests have not been responded to. They have not gotten the increased pay for holiday pay. And so that's just one small but important example of, and that seems to me to be a cost savings, because obviously it's more increased pay around holiday time. So, I mean, that, it might not be the intention, but that is the effect, that just one example of how it's working practically.
I appreciate that feedback, and if ever possible, if family members are feeling that frustration, we encourage them to reach out to our regional offices. If they are not, hearing back from the department itself. So I will definitely look into this personally.
So I appreciate that, and I guess one reason perhaps for folks being vocal about this is there, and again, this is what I'm hearing in my office, is just a lot of frustration with not getting responses and
Absolutely.
not getting answers from people. And I understand you cannot physically handle all those answers and work in your central office, but the frustration with not, because it, you know, these are substantive changes that people are being required to comply with now. And so there are lots of questions about them. And I think there's, my sense, and it's being shared with me, is that there's a lot of frustration with not getting responses and clarification on what the expectations are.
Thank you for that feedback.
Thank you. Thank you, Mr. Chairman.
And thank you, Senator Hedelman. Madam Deputy Secretary, I just wanted to lean in and say I appreciate the birth for change or the birth for reconsideration in reference to low-intensity support services. I appreciate the announcement in reference to how we move forward or the path forward for fiscal year 2025. I think that I just wanted to highlight one of the issues that my colleague had brought up in reference to geo differential, and just making sure that we continue that conversation and how we can ensure that there's a path forward, but like under thoughtful consideration around that specific subject. Colleagues, seeing that there's no more questions at this moment, we're going to move towards public testimony. And I would just ask folks, we're going to bring you up in panels of 4. We do 2 minutes in reference to public testimony from that standpoint, and we'll be able to hear it out. And the first folks that we will call out, and what I'll do is maybe ask the first 4 to come up, and then I'm going to pre-warn the next 4 that will be coming up after them, so that way you can become prepared. But the first panel will consist of Ms. Angie Reese, Rico Winston, Kathleen Durkin, and Laura Howe. And after those 4, the next 4 that we'll be bringing up is Andy Colt, Matt Rice, Randy Ames, and Sue Harter.
Good afternoon, Chair McCray and members of the committee. My name is Angie Cassee, and I am here not today just as an advocate, but as a mother fighting for my daughter's future. My daughter, Samantha, is 29 years old and has Rett syndrome. Rett syndrome is a neurological disorder that primarily affects girls and has left her with severe physical and cognitive disabilities. Rett syndrome happens from a genetic mutation that disrupts the brain development, and as a result, Sam is nonverbal, has seizures, and requires full supports, in every aspect of her life. Sam relies on an amazing residential and day program supports by Springdale Center, a wonderful community provider in our area, an area that would be affected by one of the largest cuts in the DDA budget. These services give her the opportunity to live with dignity and to engage in her community and have the quality of life that every person here respects, deserves. But today I'm here because I'm deeply concerned. Governor Moore's proposed budget cuts threatens to take all of that away. For families like mine and many more that I've spoke to, this isn't just about numbers, it's about survival. Springdale isn't just a provider to us, it's a safe home, it's her safe space. She loves it there. It's a great connection to her community. The direct support professionals that support her every single day love and care for her. So if these cuts go through, organizations like Springdale will be forced to make difficult decisions about whether to reduce services, cut staff, or even close programs altogether. And where does that leave Sam? Where does that leave thousands of families like mine who depend on community program providers every single day? We need your leadership now more than ever. I urge you to fully fund developmental disability services and reject these harmful cuts. I'm asking you as legislators to, and as fellow human beings, to see my daughter, to see all the people like her. Our loved ones deserve better. Maryland must do better. Thank you.
Good afternoon, Chairman McCray and members of the committee. My name is Kathleen Durkin. I'm the CEO of the ARC Baltimore. We support over 1,400 people with developmental disabilities living and working in Baltimore City and Baltimore County. I'm here to express my deep concerns regarding the proposed cuts to the DDA budget. The support from the General Assembly over the past several years has been a beacon of hope as providers could finally begin to pay direct support professionals a decent wage. Agencies could finally invest in staffing that supported safety, but also individual choice, flexibility, and dignity. The proposed cuts to the budget not only stop that progress, but could revert us back to more restrictive institutional models, especially the reduction of dedicated hours. The current proposal will significantly reduce the overall funding for a home, removing some of the base hours that are built into the rate for others in the home, and requiring that those hours be used for the person who needs dedicated support. Without adequate funding, providers will be hesitant to support people with more complex needs. People will have less opportunity to explore individual interests. But it's not about the numbers. This is about the people and the people impacted. So I want to share a few stories. Wilbur broke his ankle in December. He had to be booted, and he had to stay home till it recovered, and he needed dedicated support. Charles is battling cancer, and he goes to chemo during the day with dedicated support. James attends his childhood church each Sunday, and he's able to do that with dedicated support while his roommates stay home with other staff. Keith has significant medical needs, including a G-tube, and he loves to be social. He likes to bowl, he likes to go to country music concerts. Go figure, his longtime roommate, Charles, is 87, and he's a homebody. And his other roommate, George, will soon be starting in-home hospice. Dedicated support allow all three men to live and to die with dignity. None of these scenarios will be possible without dedicated hours. The cuts will take away the ability for a person to live the way they choose with a proper level of support and flexibility. Thank you.
Good afternoon, honorable and distinguished legislators. My name is Rico Winston. I'm a solo parent of an amazing son whose name is Israel. As a board member and chair of the Government Affairs Committee at the ARC Baltimore, advocating for individuals with disabilities, my mission is both professional and deeply personal. My son Israel is 15 years old and has autism. While together as a father and son, we fight and advocate for policies and services that support individuals like Israel. I also am a father and overwhelmed with uncertainty of his future. That's why I'm committed to ensuring that we build a sustainable, inclusive system, one that guarantees every individual with disabilities the dignity, support, and opportunities they deserve. The reality is that many critical services such as housing, employment support, and community programs are already stretched, then due to lack of funding. Additional cuts in funding would be devastating to individuals and the developmental disability communities, which are already underserved. As Israel nears adulthood, I worry whether these essential resources and services will be available for him and other families should not have to face this uncertainty. DDA services are critical to families such as Israel and I. Budget cuts will jeopardize Israel's future and all that I hope for him and all that envision for him to be.
Good afternoon, everybody. There are so many who are counting on each of you. Now it's the time to strengthen the commitment to support essential supports, not just for today's individuals, but for the generations to come. I am the future, and I am the future of Maryland. I am asking for you to stand by my side and with all individuals with developmental disabilities. Thank you for your time.
Thank you. Thank you all for your advocacy, but Israel, I did want to say it's great to meet you. You look sharp up there, brother, and next time I see you coming, I'm going to grab my best black suit, make sure that I got it on. So, yeah. Colleagues, at this time, we're going to...
Mr. Chairman?
Yes,
Any
ma'am.
chance I could go?
Oh, I
I've been
apologize.
spoken. I know. It's okay, don't worry about it. Anyway, good afternoon, Mr. Chairman, members of the committee. I'm Laura Houghton, the CEO of the Maryland Association of Community Services. We represent about 125 community providers across the state of Maryland. The first thing I want to say about the budget growth in DDA is that when a system is starved for decades, it's not surprising that we are in this situation where we see a lot of growth, because the growth, much of it was absolutely needed. And prior to 2015, we saw almost no rate increases for years. There was a 7-year period where the total rate increase across all 7 years was less than 1%. So these services were terribly underfunded. The other thing I want to say is that of the $195 million in rate increases for all services, in the last 2 years, 90% of it was related to the increase in the minimum wage and the acceleration of the minimum wage, and the governor and the General Assembly did the right thing in approving that funding. I just want to speak quickly to the two major cuts that affect community providers in particular, and the people we support. The elimination of the geographic differential rate for the 5 counties, Montgomery, Prince George's, Charles, Calvert, and Frederick, would create a statewide rate without the data, the wage data from those 5 counties included in that rate. And we believe that is deeply problematic and would also require a revision, could potentially lower the rates paid in those 5 counties, but increase the rates paid in the other 19 jurisdictions. the change to the dedicated hours policy, it's the most complicated issue, but it basically collapses the infrastructure for the homes, the funding infrastructure for the homes where people have dedicated hours. And I want to say that in the most simple terms, if you tell your boss you need a raise because of a particular reason and you prove it, and he gives you the raise or she gives you the raise, but then they cut your wages, the rest that you make every week, are you really ahead? You're really not. So we want to thank you for your support and happy to answer any questions.
Senator Zucker.
Thank you very much. One quick comment. Israel, you got a great future and we got your back. And then second is for Ms. Howell. So are you seeing anything on the ground yet in terms of, I know that there's been some movement, and I really applaud the administration for, and the Budget and Taxation and Appropriations Committee, but you seeing anything on the ground yet in terms of cuts being implemented, like just to keep us posted on what's happening? But
Right. Thank you for that question, Senator Zucker. First of all, we as a community, I think it's safe to say, are just really happy with the announcement that came out today from the administration and the budget leadership to address much of the funding cuts for FY25, a huge step forward. In terms of what we're seeing on the ground, we are really concerned with the dedicated hour change. We started seeing several months ago, and we have providers across the state that are reporting that, and we are really concerned about that being implemented before the legislature has even made decisions about these budget cuts.
Seeing no further questions, I just wanted to thank you all again for your testimony. Colleagues, I'm going to call up the group that we were pre-warned that were coming: Sue Hartnett, Matt Rice, Andy Culp, Randy Ames. And the group after them will be Sean Crows, Ken Capone, Laura Lear, and Rachel London.
All right. Well, good afternoon, Chair McCray and members of the committee. My name is Andy Culp, and I'm the Executive Director of the ARC Maryland. And for the past 60 years, the ARC Maryland has worked to protect and advance the rights of people with intellectual and developmental disabilities and supports to their family. And you have my written testimony, so I won't go through that, but I do want to talk about the proposed, a couple of points about the proposed cuts in fiscal year 26. The budget cuts proposed chip away at the building blocks of our service rates. They're the rates that were built over 10 years and are cost and data driven. Changes must be identified and long-term solutions must be identified and developed with an examination of the human impacts. Related to sustainability and cost controls, we urge our leaders to take a look at transitioning youth trends, what they truly need upon their transition from high school, and reasonable costs for these services. So TYs typically enter developmental disability services through the community supports waiver, and prior to January 2021, that waiver was capped at $25,000, but that year, the spending caps were removed from the community supports waiver and the family supports waiver. In 2022, new enrollees to the community supports waiver had average budgets of around $15,000, which is pretty low. But according to data from the Hilltop Institute, in fiscal year 24, new enrollees to the same waiver had average annual service budgets of $59,000, so a pretty big jump since the removal of the caps. While the data is not publicly available for FY25 yet, it's our understanding that transitioning youth budgets are now well over $100,000 on average. So the needs of people entering our services hasn't changed that much. Although the rates for services have increased over time, those increases don't account for these overall budget growth numbers. We believe this is where the department should look for changes to policies. Transitioning Youth Initiative was intended to ensure students exiting from high school continued to have meaningful activities during the day, including support to work, and so their families could continue to work. So in closing, We've heard our budget referred to as a black box, which is a metaphor for a system that's opaque, unclear, and unpredictable, which isn't a great way to effectively and prudently operate a system that's so vitally important to the health and safety of 20,000 Marylanders with IDD. Our system is complex, but it does not have to be a black box if the people in charge of the system and responsible for people within the system truly understand how it works. So we remain committed and ready to work with the department. And thank you. I just want to thank you for hearing my testimony today on behalf of the ARC Maryland.
Sue, you want to go?
I'm Sue Hartung, and I'm a mother, and I'm also the vice chair of the Montgomery County IDD Commission. In 1971, I was getting ready to graduate from high school, and I wanted to pursue a degree in special education, and the Great Oaks Center had just opened. It was brand new. It was a beautiful facility designed to provide comprehensive services to individuals with developmental disabilities. My friend and I decided to do our senior internship there. Several afternoons a week, we would go over and try to provide some enjoyment to the one unit we worked with, which had about 12 girls ages 8 to 12. It was challenging because they were confined to their unit, which was 3 rooms where they ate, slept, and bathed, and most of the girls spent their day laying in bed. One day we arrived and staff said, we're doing something different today. We're going on a nature hike, and we were thrilled. Until they walked out of the unit, through the playground, into the neighboring woods, and proceeded to light up their marijuana cigarettes. That was the last day I did an internship at Great Oaks. 23 years later, my husband and I are struggling to raise our 4 children, 2 of which have developmental disabilities. My son has a rare genetic disorder that had not yet been diagnosed, but leaves him with the inability to speak or take care of his personal needs, and my daughter has autism. We struggled every day. Then a social worker said to me, apply to DDA. They're getting ready to unlock the waiting list. Within a few months, thanks to DDA and the provider community support services, my children went to an after-school program, and that eventually led to weekend programs, something wonderful called Respite, and 10 years ago led to them being able to live in townhouses in their community with a roommate, with staff that not only support them, but love them. They work and volunteer in their community, they dine there, they shop there. They're really part of the fabric of the community, and they come home to see us every weekend. The life they lead today was unimaginable 35 years ago. And there has not been a day in the last 35 years that I have not thought of my girls in that unit at Great Oaks. If the budget cuts go through as said, we could end up back in the days of Great Oaks. And you guys can't let this happen. We just can't. Thank you.
Good afternoon, Chair McCray, members of the committee. My name is Matt Rice. I'm the Executive Director of People on the Go of Maryland, which is Maryland's statewide self-advocacy organization ran for and by those with intellectual and developmental disabilities. I'm here today on behalf of the 400 people I represent to ask you to please support the Developmental Disabilities Administration budget, which not only supports 19,000 Marylanders, some of our most vulnerable, but supports me personally. I can tell you that POG's perspective is that all people, regardless of service model, deserve to have the choice of where they want to live, with whom they want to live, and the types of services they receive. I think what we've seen over the past few weeks and months as we continue to have these conversations is there's much emphasis on cost containment, and I myself had a person-centered plan that was in auto extend for nearly a year, leaving me in personal jeopardy after losing my enhanced supports. I'm also concerned about the proposed cut to the provider rate for provider services. The reality is the service system needs to work for everybody. All staff need to know that they're going to get a reasonable living wage. I have 2 staff. Both of them support me as much as they're able, and it's not fair for the state to say, well, now you might have to take a pay cut after, supporting Matt to work 18, 15-hour days. So support the Developmental Disabilities Administration budget. We can find a way forward, but we need to do that in a sensible way that works for everybody. Thank you.
And thank you. Colleagues, seeing no questions, we'll move on to the next panel. The pre-warned folks were Mr. Sean Crows, Ken Capone, Laura Lear, and Rachel London. And after that will be Najla Wortham, Tim Weems, Steve Keener, and Pim Browers. And whoever wanted to start.
Good afternoon, committee members. My name is Ken Capone. I am here today speaking before you as a disability policy advocate and a representative of the ARC Maryland. We are here today to testify in support with amendments to the developmental disabilities budget. I am a person with developmental disabilities, and I depend on the services and supports funding I receive in order to live, work, and socialize in the communities I choose. I am also a disability policy advocate that has spent many years of my adult life testifying and advocating for positive change for people with disabilities. The Maryland General Assembly stepped up when the advocacy community put forth the Ken Capone Equal Employment Act that eliminated wage discrimination against people with disabilities in one session. I have advocated and educated for decades for the necessary funding to support people with disabilities in the community. Maryland was moving the needle in the right direction to eliminate discrimination and support the direct support professional wages. The proposed budget cuts, if approved, will have major consequences that jeopardize the health and safety of Marylanders with disabilities. The proposed budget cuts will make it very challenging to hire and retain qualified direct support professionals. This will lead to a significant reduction in essential services and supports that help individuals with developmental disabilities remain active members of their communities and put them at risk of institutional care. The developmental disability community is grateful for passage of the minimum wage funding. The minimum wage funding gave providers and people who self-direct more funding to pay staff. We have made strides in paying those who support our everyday needs to be successful. Much of the progress that has been made in the last 10 years will be for nothing with these proposed cuts. What will this cut do to that profession, and what will people with disabilities have in the end to help them live their lives? Additionally, these cuts are likely to result in more people not having the choices they want and need in their lives. Providers will have a harder time supporting people and will not expand to support new individuals. We have made strides in paying those who support our everyday needs to be successful. We don't want to go backwards 50 years ago when people with developmental disabilities were at risk of institutional care. People with developmental disabilities have the right to make choices about their lives and the assistance they receive in the community. We need to find budget solutions that support both models of service, reduce the wait list, and strengthen the workforce that is so important to everyone who receives DDS services. I urge you to reverse these budget cuts and continue improving the performance of the developmental disabilities service systems. Thank you.
Chair McCray and esteemed members of the committee, my name is Laura Lear, and I'm the CEO of Community Support Services. The proposed budget cuts have significant implications for the people we serve and the DSPs who support them. The proposed cuts will take funding back to unsustainable levels, and we will not go back. Let me tell you about Joe. When Joe was 8 years old, he became a ward of the state and was placed at Great Oaks. Joe has a profound intellectual disability and is nonverbal. With no one to speak for him, there were no choices for Joe. At the age of 31, Joe's life changed dramatically when he moved into a townhome operated by CSS. Since then, Joe's held several jobs. He loves eating out in restaurants, visiting parks, music classes, and so much more. Joe is not going back. Let me tell you about Sam. In 1990, Sam left Sierra Leone and moved here in search of better opportunities. He worked various entry-level jobs until a friend encouraged him to apply to Great Oaks, promising higher pay. Sam says he came for the pay, but stayed because he fell in love with the people he supported, including Joe. In 1994, Sam followed Joe to CSS. He experienced Joe's transformation firsthand and what it meant for Joe to finally have choices. Sam took Joe on his very first vacation, a trip to Canaan Valley. Joe's life in the community is possible with staff like Sam. Today, Sam is a day and employment coordinator with CSS, and he has dedicated his career to supporting people like Joe. Sam will not go back. We cannot go back. Without adequate service funding and community providers who support thousands of people like Joe and who employ dedicated professionals like Sam face an uncertain future. Reducing DDA funding, which receives a 50% federal match, further reduces revenue to the state of Maryland. Current rates were established based on a multi-year study, and cutting rates without proper time and data to evaluate the impact is reckless. These funded rates have allowed us to recruit, retain, and train the DSPs needed to support people like Joe. Turning back funding levels would be a betrayal of that progress. We must never go back.
Good afternoon, Chair McCray and members of the community. My name is Shawn Cross. I'm the President and CEO of the ARC Northern Chesapeake Region. We support over 400 people and their families in Harford and Cecil counties. The proposed revision to the dedicated hours policy in residential services will cut $2.5 million annually from our residential program, which is a 15% reduction in our residential budget and a 10% cut to our overall agency budget. Let's be clear, this revision is a direct cut to critical supports. We serve 93 people who live in 31 homes in Harford County and require 24/7 support. These cuts will make it even harder to provide the high-quality care they deserve. But behind these numbers are real people, people like Colleen, Josh, and Brian. All three attended the rally in DD Day because they understand firsthand what is at stake. Colleen's mom lives in a nursing home, and she needs supports to live. Brian, who is blind, requires supports to live, and his father knows that this is important because he's not going to be here. Josh uses a wheelchair and requires an accessible home where he feels safe and is treated with dignity. Families trust us with their loved ones. Rodney, Rose, Kathy, they find peace in knowing that their children will be cared for when they're gone. Rose summed it up very well when she said, "We're more than a service provider, we're a lifeline." For Tiffany, B, and Matt, the ARC NCR is the only family they have. They came to our services because Adult Protective Services knew that they were not safe living in the community by themselves. Silva has been waiting for over a year for her services to be approved. In the meantime, we continue to support her without payment because the alternative, leaving her without help, is unthinkable. Her struggle highlights how complex and unmanageable this system already is, and there are many more like Silva. These cuts will only make it worse. These stories represent just a fraction of those impacted across Maryland. Let's work together to safeguard and strengthen these critical services, not diminish them.
Good afternoon, Mr. Chair, members of the committee. I'm Rachel London, the Executive Director of the Maryland Developmental Disabilities Council. As a reminder, we are an independent unit of state government and 100% federally funded to create change to make it possible for people with DD to live the lives they want with the support they need. First, let me express our appreciation to and leadership of Governor Moore and the Budget Committee leaders in developing a plan to avoid most of the costs in fiscal year 25. We have a lot of work ahead, though. We commit to continue engaging in conversations and finding solutions. Let me next say that the solutions have to ensure people with DD can choose how they receive their services. You've heard that people receive services through providers, people receive services through the self-direction model. Both are important to all of the people, and they have the right to make that choice. While changes can occur, any actions, funding or policy-wise, cannot put people at risk. And ultimately, changes really should build the capacity of both models. So Maryland has a strong, well-funded service system that supports the Marylanders with DD that we know about and those that we don't. Second, I just want to go back to the basics for a second. Everyone, regardless of service model, gets services based on their assessed needs and their person-centered plan. Everyone has different needs at different points of our lives. That's true for us. That's true for people who receive services. And our system has to be flexible enough to meet those needs as they change and in the current way people need them. So really, to sum it up, we want to continue to work with you and the administration to find solutions with the least amount of impact on people with DD, their families, the direct support professionals, and providers. And we need to work to preserve a person's right to choose how they receive their services. Thank you, Mr. Chair.
And thank you. Colleagues, seeing no questions, we'll move on to the next group. I'll repeat the names of the folks that we pre-warned. Ms. Najla Wortham, Mr. Tim Weens, Mr. Steve Keener, and Pim Browers. Next, we'll be calling up Leslie Thompson, Cody Stevens, Michelle DeFeo, and Angela Knoppenberger will be after this panel.
Yeah.
And anyone can go first.
Good afternoon, Chair and members of the Maryland General Assembly. My name is Najla Wortham, and I'm the president of the Rock Creek Foundation, a provider of services for individuals with intellectual and developmental disabilities in Montgomery County. And I am here to urge you to fully fund the DD budget and reject the proposed cuts that threaten the stability of services for people with IDD and the workforce that supports them. With the transition to LTSS and the increased rates, Rock Creek was finally able to make real investments in our DSP workforce, investments that were long overdue and that we could not afford under the previous rate structure. Over the past 2 fiscal years, we've raised wages, provided end-of-the-year bonuses, and increased our starting DSP salary to over $20 an hour, finally surpassing Montgomery County's minimum wage. This has been transformative for our DSPs who provide essential life-changing support, yet even at this wage, many of our staff still have to work multiple jobs to make ends meet. The geographical differential has allowed us to attract and retain top talent in a workforce that has not stabilized post-COVID. Additionally, the elimination of state-only payments will have a profound consequence for individuals who are ineligible for the waiver simply because they've done what we as a society encourage them to do, gain employment, excel in their work, and contribute as taxpayers. At Rock Creek, we are already witnessing the impact of these proposed cuts due to the impending elimination of state-only payments. We've had to assist one of our longtime consumers in prematurely retiring from the Department of Energy after 27 years of dedicated service, just 2 years shy of reaching full federal retirement. The financial impact of these cost containment measures on Rock Creek is significant. We see firsthand the impact of these services every day. We support individuals without community-based services who would have no place to go. We work with families who rely on us to provide stability, safety, and opportunity for their loved ones. Our DSPs show up every single day providing care that allows individuals with IDD to live with dignity and independence. Please maintain the budget.
Good afternoon. I'm Steve Keener. I'm the Executive Director for Jubilee Association of Maryland. We are a nonprofit community provider that supports 200 people. The proposed geographic differential elimination and dedicated hours policy change would cut $6.8 million or 19% from Jubilee's budget. Taking 19% from our DSP pay would mean a $4 per hour drop, landing below our county's anticipated minimum wage for FY26. Those are the headlines for community providers. I want to talk about 2 more issues that are getting less attention. First, DDA's proposal to reduce state-only funded services threatens people who are ineligible for the Medicaid waiver. For example, Alex. He can't get Medicaid waiver funding because he had a chaotic childhood and his disability was not documented before age 21. Maryland's state-only funding makes it possible for Jubilee to support Alex. He says with Jubilee, he finally feels like he has a family. DDA must honor its commitment to those who will never be eligible for the Medicaid waiver. And second, before the proposed cuts, DDA has already quietly changed its dedicated hours policy. Joan, age 63, has received dedicated support for 4 years for seizures and for falls, but was recently denied dedicated hours. Why? Like many, Joan was told her needs were intermittent and non-continuous. When we contested this, DDA told us we should consider just having her sit in a wheelchair. There's no doubt that reform is needed. We want to work with you on a sustainable path to continue Maryland's progress. Thank you.
Chairman McCray, members of the committee, my name is Tim Weens. I'm the Executive Director of Maryland Inclusive Housing. We were created just over 5 years ago to help the state DDA transition from a group home model to more of a supported living model, where individuals could choose where to live. And so if you don't live in a group home and you don't live with your family, where do you live? And that is basically the challenge that we were given as an organization to address. I have submitted written testimony that outlines our work in this area, how we go about that, what our accomplishments are. We're funded in a couple different ways, but in the budget is included a $260,000 grant that funds our infrastructure to do this work. And so I am here today to ask for your support for this appropriation. It's the same level as we were funded last year, so it's not an increase, and we're appreciative of that. The other thing I would just like to draw to your attention is DDA started a rental subsidy program a couple years ago. This year, the current year, it's kind of underway. It's designed like a voucher program, helps people that are DDA eligible to live independently. Again, that's funded at the same level from FY 25 to 26, and we would ask you to support that as well. We were set up and we collaborate with DDA looking at both technology issues and housing models. DDA has been very collaborative in this work. We salute them for that collaboration and look forward to continuing to work with them to kind of take the system in new directions that can be both better for people and I think more cost efficient. Thank you.
Good afternoon. My name is Pim Brouwers, and I'm the father of Alex, who is a young adult on the spectrum, currently working part-time as a federal employee at NIH. He was able to get this position through his participation in Project Search, which connects young adults with disabilities to competitive employment, administered by SEEK, a community service provider. He's still supported by SEEK through a job coach to be successful in his position. When I was still at NIH, I also was the supervisor of a similar young man, Justin, who participated in this project and subsequently was hired as a federal employee and continues to receive support from a DSP through SEEK. This internship program and the continuing support of SEEK DSPs following employment have been critical for Justin and Alex to be successful in their job and achieve promotions. The DSP support also significantly facilitates their acceptance and inclusion in the teams that they work, and as well as creates a greater cohesion among its members. Having a job that is in line with your abilities allows you to grow your skills and be a contributing member to your community has made an enormous difference for Justin and Alex. I've seen their confidence and abilities grow. They have now enrolled in online courses and even started certificate programs at Montgomery College, all supported and encouraged by their qualified, experienced DSPs. For Alex, Justin, and young people like them, the proposed cuts to the DDA budget will have a major impact. They will affect the availability and quality of the DSPs because wages will have to be reduced, so better opportunities may be available elsewhere and less services will be available. It will send us backwards, so after so much progress has been made. I understand there have to be budget cuts, but I ask that the current proposal be paused and reconsidered, and that DDA sits down with the legislature, community providers, those in self-directed services, people with lived experiences, and other stakeholders in person for a meaningful discussion to create a fair, equitable, workable plan to go forward. Thank you very much.
Senator Zucker.
It's been a while. Just had a quick question. I just can't find it in your testimony real quick. So you mentioned a $260,000 figure and you said infrastructure. Are you talking about capital? You're talking about operating money?
Right.
Okay,
right.
thank you.
Seeing no further questions, colleagues, I want to call up the folks that we pre-warned, Ms. Leslie Thompson, Cody Stevens, Michelle DeFeo, and Angela Knoppenberger. The next group that will come immediately behind them will be Joan Warren, Jessica Gallatin, Scott Thigpen, and Elizabeth LaFrance. Yes, sir. That makes sense. And to the listening audience, the reason why we did the unique of just pre-warning folks of who would be coming in, so that the folks that are still giving testimony that may be in the overflow can then come in. So we would like to ask if it is possible, if folks that have given testimony can make room for those that still have to give testimony that may hear their name as they're being pre-warned from that standpoint. So I wanted to just lean in and say that, because some folks may be in a wheelchair or there may be other circumstances. Thank you. Please.
Good afternoon, Mr. Chair and members of the committee. My name is Leslie Thompson, and I am the Maryland Division Director for Chimes, Inc., a DDA service provider here in the great state of Maryland. More importantly, the mother of a young man with autism who will likely need services one day as he grows older. Reducing DDA funding for people with developmental disabilities will not only eliminate access to essential support and put housing at risk, but also yield catastrophic consequences for support service personnel in the provider community, as well as the self-directed community. Direct support professionals are the backbone of services provided to people within the IDD community and will be negatively impacted by changes to the dedicated hours policy, geographical rate differential, and other cuts in the budget. DSPs already face a stressful work environment, low pay, a high turnover rate, many with a second, third job. And each of these will only be exacerbated with the proposed cuts to designated hours as staff are forced to support multiple people simultaneously. As a result, those with IDD, as well as their support staff, will be put at an increased risk for injury and negative outcomes. The DSP workforce has been in trouble for over 25 years, and that was only exacerbated by the pandemic. However, we continue to struggle day to day with our staffing crisis. Without adequate staffing, provider organizations like Chimes, who employs over 600 folks in Montgomery County, and Baltimore City alone, will be forced to choose how to divert staffing and funding, and as a result, may be required to close the doors of some facilities, leaving our most vulnerable citizens with no place to turn. We acknowledge and understand that Maryland is facing difficult financial times and that tough decisions need to be made to create a balanced budget. However, that cannot be done on the backs of the disability community. I urge the administration to make a good faith effort to truly engage with stakeholders, to seek possible solutions and leave no Marylander behind. Thank you.
Thank you, leaders. My name is Cody Stevens. My 9-year-old son, Luke, has a severe disorder called polymicrogyria, which heavily affects his speech, motor function, cognition, emotional difficulty, severe seizures, and led to 2 brain surgeries. Our lives have been far from steady, filled with travel for therapy, doctor visits, and emergencies. Luke requires consistent assistance in all aspects of his life, not excluding bedtime, where sleep disruptions and complications occur through the night. A typical work week is 40 hours for all of us. For our family, it's 168 hours a week per person as we care for Luke 24/7. Yet we only ask for 40 hours in support individually to help manage this responsibility. Holding a full-time job with a traditional boss has become unrealistic, as our child's needs will always come first. We've often heard statements like, be here at 4 or consider your termination, end quote. A sentiment echoed by many families like ours who are forced to make the choice between work and our loved ones. Let's be clear, we live and breathe our son's needs because we don't have Plan B. Our home life has been unstable as we moved in order to access doctors, resources, jobs, and support. Luke is just now starting to feel safe and secure in a home where he can thrive. The challenges of raising a disabled child are daunting, but the DDA Family Supports Waiver has provided us with the critical support we've needed. This waiver has allowed us to stay by Luke's side, ensure he gets the care he needs, and provide him with the medical equipment to live with dignity. It's created a consistent environment where Luke can grow, learn, and thrive, and where his support team are not just professionals, they're friends in his eyes. And if these supports are taken away, it will be catastrophic for his growth. For the first time, Luke is remembering his letters and numbers, and is excited to learn each day through his homeschooling. Without the consistency that these services provide, Luke will regress, self-isolate, and face emotional triggers, sending us back to crisis mode because we've been there before. If these cuts go through, families will be forced to consider institutionalization, which has resulted in neglect and abuse in the past, while fighting for their livelihood. This will also cost the state far more in the long run. However you look at it, the quality of life of thousands of disabled loved ones across the state will take an unbearable hit, one that many families may not be able to recover from. This will hurt the state and the families. Let's stick together and support the opposition to these budget cuts.
Good afternoon. My name is Michelle DeFeo, and I am here on behalf of my daughter, Madison. Madison is 29 and has severe disabilities. She has received DDA services since age 10. When traditional providers could not meet her needs, the state introduced us to self-directed services, allowing our family to hire support staff at a higher hourly rate, avoiding administrative costs that the traditional provider typically incurs. This model has been life-changing, giving her continuity in care while saving the state money. For nearly 2 decades, self-directed services has been a win-win for families and the state. However, in the past year, DDA's communication and transparency has crumbled. Guidelines and procedures change without warning, creating unnecessary stress for families already managing significant caregiving responsibilities. But nothing compares to the upheaval caused in October 24 when DDA released a new self-directed manual without notice, input, or regard for the current policy. This manual directly contradicts the Self-Direction Act of 2022. It imposed sudden sweeping systemic changes that led to service denials and disruptions in already approved person-centered plans. Families immediately reached out to DDA seeking answers. The response, silence. With no clear guidance from DDA, desperate families turned to their legislators only to learn they too had been kept in the dark. Families like mine who have spent many years working on a stable support system are now fighting just to maintain the care our loved ones rely on. To make matters worse, this abrupt policy shift appears to be a precursor to the 26 budget cuts, raising even more concerns about transparency and accountability. If these changes stand and funding is reduced, Madison will lose the long-standing support staff who knows her needs best. The impact on her health and safety and would be devastating. After 19 years of stability, she could lose her support staff. I urge you to act now, rescind the 2024 self-directed manual, establish a true work group with families, legislators, DDA representatives, and stop the proposed budget cuts. Thank you.
Thank you, Chair McCray and members of the committee. I'm Angie, parent of Elsa 18 and Luke 15, both with special needs with multiple disabilities, receiving DDA self-directed services and at the most restrictive of the non-public schools. Do you know what it's like to be a parent of a special needs person? What about 2 of them? It's like you're in fight or flight mode all of the time. You don't know when they're going to have a seizure, behavioral meltdown, bad night's sleep, which for us is nightly. They always need help. You can't leave them alone. You want the best for them, but sometimes you just can't do it. Your body feels like it is in a constant state of hypervigilance. You have to rely on other people when they are outside your care and trust that they are doing what is best for them. Can you imagine that feeling? Now imagine you have an agency whose name is Developmental Disability Administration, set up to help people with disabilities. In previous years, an agency that has been on your side, supported you with services that really benefit your children. And for some reason, they stop being on your side. You send them emails. They either respond very late or not at all. They stop allowing services for your child that were previously given with no explanation. When you try to get one, you feel dismissed. Can you imagine how that must feel? You already have a huge permanent challenge, and it feels like the people who are supposed to help you have turned their backs. That is what it has felt like in the last year with DDA. Please, I'm begging you, for me and for all the parents out there with children with special needs, investigate this change before giving DDA a budget when it feels they are not on your side. Please help us so we can continue to help our children. Please, so we do not fall apart.
Thank you. And seeing no questions, we'll bring up the next panel. Joan Warren, Jessica Gallatin, Scott Thigpen, Elizabeth LaFrance. In the standby will be Adam Wyndham, Stephen Coburn, Patricia Saylor, and Jen Drucker. Whoever would like to go first.
Good afternoon. Let me introduce myself. I am Christine's mom, otherwise known as Joan Warren. My daughter was born with Smith-Lemli-Opitz syndrome, a very rare genetic disorder. I'm here today for her. Intellectually and developmentally disabled individuals have the right to choose community providers or self-directed services and to live a full life in the communities of their choice where they are included, participate, and are an active citizen. These are under threat. I am here today to discuss the cost containment measures targeting self-directed service caregiver wages. Participants fear institutionalization. Participants will lose strong relationships because their highly qualified caregivers will leave. Lower wages will attract less qualified and experienced caregivers unable to manage people with developmental disabilities, coupled with severe chronic health disorders and potentially behavioral disorders, placing participants at extreme risk. DDA will incur unexpected worker training costs to replace the workforce. Ultimately, participants will be forced to use more expensive community providers, escalating DDA costs, and in the end, losing their rights to self-determination and a full life. Participant families fear losing their jobs to stay home to care for their loved ones. Stressors associated with finding competent caregivers, job loss, financial hardship, while caring for the loved ones may culminate in increased needs for social services and healthcare needs, shifting costs to differing agencies. An increased number of families will be in crisis, requiring DDA intervention. Caregivers fear losing livelihood. Substantially reduced wages will create financial hardships, causing families to seek financial relief and medical assistance, again, shifting costs to other agencies. Caregivers may work longer hours and additional jobs to compensate for the lost wages, leading to fatigue and placing DDA disabled at risk for errors or harm. Loss of caregivers' presence at home will disrupt their families, placing children at greater risk for cognitive, behavioral, and emotional issues. There are research studies demonstrating this, resulting in lower levels of attainment and well-being. Mitigate this potential harm to us, our families, and our caregiver families by abandoning the DDA salary cuts.
Thank you.
Good afternoon, Chair McCray, members of the committee. My name is Elizabeth LaFrance. I'm with the Self-Directed Advocacy Network of Maryland. And in avoiding disclosure of the Bureau of Labor standard wage details, the DDA is hiding the severity of the wage cuts to self-directed services, along with the fact that they're imminent. Early last year, the DDA began wholesale denials of services, despite demonstrated need. Last fall, they choked off access to resources with the new manual. And now the DDA is asking the legislature to codify the cuts that will destroy self-direction by taking caregiver wages to the bone. The DDA wants to reduce self-directed waivers by 64% of total fiscal year 2024 spending, or $235 million on spending of less than $367 million. Participants will be forced to break their commitments to the self-directed professionals who support them. Fear, instability, and chaos are the result. The talk of cuts is making staff flee, leaving families to fill the care gap, while many face their own financial ruin. Bankruptcy, eviction, homelessness, and institutionalization are all being discussed. How long can anyone continue on half their income? Participants who have achieved independence, of course, have it worse. I spoke with a mom who asked how to break the news to her son's staff, not just because it's difficult, but because we have so few details. If they leave him, she'll have to quit her job to care for him and take the devastating pay cut herself, as they cannot afford to churn through a series of low-paid support staff. Delegates, despite what you may have been led to believe, self-direction is cost-effective. The administration may be willing to go forward with this plan, but you don't have to help. Please don't approve the cuts to self-direction. Thank you for your support.
Good afternoon, Mr. Chairman and honorable senators. First of all, I want to commend Governor Moore and the leaders of the legislature for the work they did to restore most of the FY25 cuts. It is much appreciated, and it shows the flexibility if we all work together and our voices are heard. But I'm here to introduce my daughter, Alexa. My name is Scott Thigpen. Alexa is a 25-year-old woman with PCHD19, which is a complex genetic condition that presents as intellectual disabilities, seizures, autism, bouts of physical aggression, severe anxiety, and difficulty adapting to the complexities of community settings. One of her habits is to what they call elope, bolt into traffic, to take off at no notice. And because of this complexity of the system, when she graduated from high school in 2020, there were no traditional providers, frankly, that were able to deal with the complexities of those conditions. So we enrolled her in self-directed services, which has been a godsend for her. She now attends Montgomery College in the Challenge program, She volunteers in community. She is developing her own business, making arts. She takes classes at Viz Arts in Rockville. It's been a life changer. But the cuts that the DDA is proposing would be devastating. Many people have noted that these are barely above minimum wage, but to put it in perspective, these are people that are getting hit. These are people that are responsible for people's lives, that have to deal with emotional, physical, and mental crises every day, and we're asking them to work for a couple bucks more than minimum wage. That's not realistic. And frankly, SDS, some of the salaries, we cannot pay benefits, so we have to offer them more. And there's no knock on the traditional providers, but they can offer benefits. So what we would ask is that we sit down in a transparent arrangement with DDA. You have the most creative people in the world in this room, and we sit down and we put together a program that works for all of us moving forward. Thank you.
Hi, good afternoon, Chair, members of the committee. My name is Jess Gallatin, and I live in Cecil County, District 35B. I'm here today as a sibling of a self-directing participant. Although this model provides greater choice, we did not land here by choice. Like many others, we landed here as a last resort. My twin sister, Jennifer, who's with me today, is not able to get up here and effectively tell you how these proposed budget cuts will undoubtedly change her life, but more importantly, I fear, will threaten her life. You all have heard for weeks about every challenge and every disparity facing our healthcare industry, the staffing shortages, the vacancy rates, the inadequate and the inept. 4 years ago, my sister's life turned upside down at the loss of our parents. I moved her in with me and my kids, but every program and every resource disappeared. We spent over a year struggling to find nurses and day programs for her to attend. Excuse me. But there were none, and she was dismissed from every local program. So SDS was the only option that we had. It was a massive relief for her, but a life-changing reality for me. And I wasn't anticipating how much I would be asked to give up. My sister and I believe that you are all listening to us today because you want to do better and are aware of the very broken system that is before you. From our perspective, it is a system that became shell-shocked but enlightened by the COVID pandemic. In some circumstances, community providers realized how much they weren't needed, and families realized how much they really could do. The aftermath of programs and services has left a terrible climate and atmosphere for us all to navigate, with families navigating the obfuscation and community providers scrambling to stay in business. Unfortunately, I believe that the programs and administration have been less than transparent. I'll skip most of this. But please understand, we're not trying to be hostile. As DDA has put it, it is human nature and instinctual to protect the ones that you love. Sustainability is not achieved by rushed and careless, blanketed approaches. Advising sweeping denials and reductions for things already determined to be needed is careless and a mistake. Tough decisions will be made. We understand the budget, but they should be made with mature calculation, sophistication, and empathy. It is too much to be asked to give up your child, and it's too much to ask me to give up my sister. We have no choice but to be here today. So I thank you all for your time, and I encourage you all to please ask us what's been going on. Please ask the tough questions, and please ask my sister how she feels about any of this. We're happy to meet with any of you. Thank you.
And thank you. Colleagues, seeing no questions, I'm going to ask for the next panel that we pre-warned. Adam Wyndham, Stephen Coburn, Patricia Saylor, and Jen Drucker. The panel that will come after them will be Marla Hollander, Leslie Frey, Cody Drinkwater, and Karel Resnick.
Good afternoon, committee members. My name is Adam Wyndham, and I'm here today as a parent and advocate for individuals with intellectual and developmental disabilities. I am deeply concerned about the proposed cuts that unfairly target self-directed services, cuts that will cause irreparable harm to families like mine. My daughter, Emily, has Rett syndrome, a rare neurodevelopmental disorder that primarily affects females. It is caused by a random mutation on the X chromosome, which disrupts communication between the brain and the body. People with Rett syndrome require extraordinary care, and self-directed services has successfully provided that care, offering Emily opportunities traditional services failed to deliver. I believe DDA has been unfairly targeting self-directed services. Why is it okay for the state to spend money on overhead and profit in traditional services, but not let that money benefit participants more directly in self-directed? These proposed cuts would slash caregiver wages to unsustainable levels, leaving families without critical support. A single parent working full-time as a caregiver under these changes would see their income plummet, pushing them into poverty, public assistance, or out of caregiving entirely. I myself will be forced to go back to work, and then who is the school going to call when Emily has another emergency? Who are they going to call, or who's going to take care of Emily when she's having a bad day if I'm at work? Meanwhile, the governor's budget includes across-the-board raises for state employees. If Maryland's truly in a financial crisis, why aren't we prioritizing government salaries over the most basic needs of people with disabilities? These cuts disproportionately target the most vulnerable while ignoring more equitable budget solutions. For over a year, families like mine have been battling unclear, arbitrary decisions from the DDA. The agency that should be supporting us is instead making it harder for individuals with disabilities to receive essential care. This must stop. I urge you to reject these cuts and pass legislation that protects our community and mandates that the DDA has a duty to assist individuals with IDD. We should not have to constantly fight the agency that's supposed to help us. It's exhausting. I didn't ask for this life. Emily didn't ask for this life. We need a system that works for people with disabilities, not against them. Please do the right thing and reject these proposed cuts. And for a small glimpse into my life, I encourage you to watch the Disney movie Out of My Mind. Thank you.
Good afternoon, Mr. Chair and members of the committee. Thank you very much for this opportunity to address you. I'm Jennifer Drucker. I'm the 55-year-old mom to Cassie, my 25-year-old daughter. I'm a single mom with no financial assistance before joining self-directed services. I had Cassie right after earning my master's degree, giving me no chance to establish a career. Their dad couldn't handle autism and exited. I must rely on outside help just to accomplish basic things like grocery shopping. And it can't be just anyone helping me. It has to be someone who understands Cassie, someone deeply familiar with her needs and behaviors. Cassie has profound autism, epilepsy, rapid cycling bipolar disorder, and hearing loss. Because she can't communicate, her anxiety is high and her behaviors can be extreme. To avoid meltdowns, we stick to strict routines. Self-directed services gave Cassie a life, a community to engage with, and purpose. And it gave me a way to survive. For the first time, I was able to be compensated for some of the hours I care for Cassie, a necessity when I'm on duty 24/7. Often her care requires 2 people because I'm not strong enough alone. Day programs were unable to handle her, so self-direction was our only choice, and I'll never give up on my daughter. When we joined self-direction, we were shown a chart of pay rates, and we followed their rules. I made financial decisions based on those assurances. I signed a lease, and I budgeted. Now pay is being slashed. I will no longer be able to afford our home or even to put food on the table. No apartment or townhouse will tolerate Cassie's behaviors. I know this because I've been through it. So we will have nowhere to go. To make matters worse, our main caregiver just left because of the instability the DDA is causing. There's no job security, so she took a private pay job. With the cap on goods and services, Cassie will no longer be able to have even 1 hour of activity on weekdays. If you pass these cuts, you're not just balancing a budget, you're breaking families. My daughter's care is not a line item, it's her life and my life. We depend on these services to survive. Without them, we'll fall into crisis, and my daughter will be left without the care she needs. We're already stretched beyond our limits. Do not ask us to endure the impossible. Protect these services, because without them, we will not make it.
Esteemed Chairman and committee members, thank you for this opportunity. My name is Patty Saylor. I'm a nurse and I'm a member of the Self-Direction Advocacy Network. And I was a parent of a child that was, or a young man who was in self-directed services. So I've been in this DDA world for over 35 years. I've been providing nursing services to over 250 different people over the last 20 years. I've sat at a lot of kitchen tables with moms just like this, and I continue to do that. You've heard much of my testimony already, so I won't go into every detail. But just to emphasize that the cuts have actually been happening. Since this time last year, denials of services, denials of access to the services that have been approved, process delays that resulted in people's plans expiring, going into auto extend, where even further services were not available in auto extend. I think many of us agree that families are the state's best natural resource when it comes to supporting children, ill or elderly family members, or the loved ones that we have with developmental disabilities. Many people self-direct, live with their family members, or choose to hire family as staff. Of course, many do not. Community providers provide a network of invaluable services to individuals and to families, and a safety net of residential supports when necessary. State-run residential facilities and nursing homes are often the last resort when providers or families can no longer meet the needs of an individual. So what do we think is going to happen? Well, to tell you the truth, I'm old enough to know. We don't have to guess. Wages will be cut, skilled long-term staff will quit and be difficult to replace. Parents will lose or give up their jobs. Family stressors will skyrocket. Physical, mental, and economic health will break down. Chronic illness, ER visits, hospitalizations, mental health crises, and the list goes on, you know. Often culminates in, we can look backwards when we look at child abuse or people abuse to be able to look back and see where it all started. So I'm just going to ask you that to not take us back. Nobody in this room can have a conversation about institutional living again. We cannot go there. And thank you for what you're doing. And we just continue to ask that you continue to problem solve this issue. Thank you.
Good afternoon. My name is Steve Kober. My 26-year-old son is a participant in the self-directed program. He has autism, limited verbal communication skills, and due to escalation in violent and physical assaults to me and his mother, it was no longer safe for him to be in our house. And we submitted in the fall of 2024 his annual budget based on him living on his own. My key message to the committee is as follows. 1, self-directed is effective and works. Our son has adjusted well to this new place due to hiring highly qualified and cohesive communications amongst staff, our son, and family. 2, his behaviors have de-escalated due to highly trained staff, which offer consistency and continuity of care. Number 3, self-directed is cost-effective. The family proactively made concessions that resulted in a 45% reduction to the model proposed by DDA. Our initial budget was denied due to not cost-effective, and DDA requested us to look at a supported living model. All providers interviewed required 2-to-1 funding. This would have resulted in a significantly higher budget and a loss of employer authority over staff. We offered DDA a non-enhanced rate for staff, but requested just a slightly higher rate than the standard rate since it was going to be a 1-to-1 staffing. DDA quickly approved the budget, but now has denied the rate increase, wage exceptions, based on the implementation of new policies. So far, our staff is staying, but this may not be the case, as if wages drop further, our son will not be able to stay in his own house. He will not be able to come home, and he will be forced into a more traditional setting where it will be a 2-to-1 ratio and will be a higher budget. So I ask, before cuts are made, bring us to the table so that we can discuss alternatives to reduce costs, but preserve dignity to those that participate. Thank you.
Thank you. Colleagues, at this time, if we can ask for Ms. Marla Hollander and Leslie Frey to come up.
Thank you, Senator. I'm Leslie Fry. I'm here on behalf of Montgomery County Executive Mark Elrich. You've heard some really moving testimony today so far, so I'm just going to add my me too on behalf of the county executive about the impacts that these cuts would have on the residents of the county and the service providers in Montgomery County. I did want to highlight one thing that I heard in response to DDA's comments earlier, and that was that a waiver amendment for the geographical rate differential would take some time to implement. And I just want to caution that if those cuts do go through in FY26 after that time has passed, it would be particularly devastating if all of the funding were cut after a significant amount of time in the fiscal year had lapsed. So what I'm saying is, if that money goes away later on in the year, those cuts are even more devastating. So I just want to bring that to your attention, and thank you for allowing me to testify.
Thank you, Chairperson and Honorable Committee members. I'm here today to register opposition to the reductions in DDA funding, as many of the people in the room are doing so. My name is Marla Hollander. 2 words, intense and insanity. It's been challenging to keep up with DDA's constant changing rules and procedures and the budget implications. Think whack-a-mole. I live in Kensington, Maryland. Ben, my 20-year-old son, currently self-directs his waiver. No traditional provider would support him. It's been a blessing to go to this model, but cuts to the budget, specifically cuts in staff wages and limits on funds for IFDGS, puts Ben's ability to be in the community at risk. The insanity is impacting thousands of people. Ricky is one of Ben's staff and has worked with Ben since Ben was in middle school. They are like an old couple. Ricky's a trained DSP. He keeps Ben safe, productive, and connected to community. He's seen him in settings with staff that are not trained, and watching Ben melt down and finding the right place and the right staff have been really crucial. Ricky not only nurtures Ben, he's also a single dad. He makes a living wage as a DSP working for Ben and supplements that as a DJ. Salary cuts, loss of geographic differential for DSPs and self-direction, aligning with the BLS rates, akin to what my teenager daughter makes babysitting neighborhood kids, FYI, is just not appropriate for our trained DSPs. Wage cuts would make it hard for Ricky to keep working for Ben, take care of his family. Losing Ricky and Ben's other trained staff would be devastating for Ben. I would likely have to shut down my consulting practice. It would impact our taxes, our ability to live and survive. If only DDA would connect authentically with community stakeholders. Several groups are here today, as stand the Concerned Citizens of Self-Directed People on the Go, Maryland Inclusive Housing, the ARC. They all have viable, innovative budget solutions and are willing to roll up the sleeves, but they're not being listened to. In closing, I'm grateful for our waiver supports. I'm grateful for each of you for listening, for rolling up your sleeves, and helping our community. Thank you.
Thank you. And colleagues, seeing no further questions, I do recognize, and we all recognize, that folks come as far as Western Maryland, Eastern Shore, Baltimore region, and the DC region. So we just wanted to give the opportunity for someone that may have the intent to sign up and may not have been able to sign up at this moment to come to the mic. Are you standing?
Yes, sir.
Yes, ma'am, please.
Good afternoon. I'm here on behalf of Disability Rights Maryland. Disability Rights Maryland is the state's protection and advocacy agency. We are authorized by federal law to protect and advocate for individuals with disabilities across the state. We work with hundreds of individuals with IDD annually who are served by and seeking services from the DDA. These services allow Marylanders with IDD to thrive in the community without the fear of being institutionalized. Still, we hear from our clients about the direct impact on them by the ongoing direct care worker shortage in the state. The dangers posed to DDA participants by this ongoing shortage are high turnover, the widening deficit in home healthcare workers, and a general post-COVID shortage of healthcare workers statewide. I direct this committee to review the commission to study the healthcare workforce crisis final report submitted to the General Assembly in December of 2023. The impact of these proposed budget cuts will only exacerbate that direct care worker shortage. DDA participants will be the people who are forced to shoulder this burden. These budget cuts will pose a higher risk to DDA participants of hospitalization and institutionalization, which means that the state may bear the incidental costs of increased ER visits, hospital stays, and admissions to nursing facilities. These budget cuts that would reduce community services and create a risk of institutionalization and segregation of people with disabilities violate the Americans with Disabilities Act and the community integration mandate of the Supreme Court's decision in Olmstead. We implore the committee to carefully consider the legal implications on people with disabilities across the state of Maryland if these budget cuts are passed. Thank you. I yield my time.
Thank you, colleagues, and more towards the listening audience. As we conclude the public testimony, I think that it's important to say for each organization, each advocate, each parent, sibling that we heard from today, that we hear you and we see you. I think that the Deputy Secretary started off in reference to the close work that's going on with the legislature, the administration, to ensure that we're given a thoughtful approach in reference to how we move forward. There's a significant and a lot of more work to do, but I do think that it is deliberating to hear about FY 2025 and how we're going to move forward and the path forward from that standpoint. So I say continue to keep in conversation with your respective elected officials. If there is opportunities where the agency may not be responsive, I think is one of the things that we heard. Our door is always open, and we want to hear from you from that standpoint. I do want to also just lean in and thank you because you took the whole ride with us. Our analysts, Ms. Martinez, just thank you for giving us the opportunity to see more clear, to hear the voices that may not always be heard, and just leaning in reference to this respective analysis. And to the Maryland Department of Health, as we do and we say always, we look forward to continued partnership, and we look forward to keeping this dialogue around this conversation. Colleagues, seeing no further comments, seeing no further questions at this time, this ends the hearing for the Health and Human Services Committee, and we look forward to seeing you tomorrow.